Hello, today we are going to talk about assessing the heart and lungs. To begin this process, this of course is a part of your assessment that you want to do on each of your patients. You will ask the patient to position themselves in an upright position. This can be done in bed, this can be done in the chair. At that point, you will use your stethoscope to auscultate the lungs and the heart sounds. You will begin with the anterior portion of the chest, and you will take your stethoscope and move to the different locations that will give you different sounds at each location. Once you have done this, you will then ask the patient to take deep breaths. With each breath, you will listen to the patient's lungs. You will move your stethoscope beginning at the top, front of the chest, just moving symmetrically as you listen, and then you will have the patient to lean forward, and you will then listen to the back. Ask the patient again to take deep breaths as you listen as they inhale and exhale in each area. At the end, you will ask the patient to say the letter E. At that point, you will listen as the sounds are made. You'll listen for any distinction in the sound in one area that might be different from another area. Compare the sides and you will be done. At that point, you want to document what you heard. If the lungs are clear, if you heard congestion, rales, rhonchi, those are things you will document in the patient's record. And that is what you need to do to hear lungs and heart sounds. Thank you.